Let's connect right now with Doctor Stevens Sumantri, who is an internist and allergy-immunology consultant for Siloam Hospitals. Good morning, Doc.
Morning, Doc.
Paul and Marisa.
Hi, I hope you're well, and thank you so much for joining us. So, when somebody experiences cytokine storm, what happens to their body, doctor?
Okay, if we want to know about the cytokine storm, we must first know about what is cytokine.
Yes.
I see in your previous explainer video, it's actually very good, already clear to define what is cytokine. But let me remind again that cytokine is actually the methods which our immune system communicates. So we could make an analogy that cytokine is the data stream that connects each of the components of our immune system. So what happens when our body contracts a disease that causes the inflammation is that the data stream becomes very large and very much.
Right.
A lot of data goes to the immune system, tells them to activate. So that's why we call that is cytokine storm, when there is a lot of data comes into the immune system, makes them hyper activated. And we know that our immune system usually functions as a protection for our bodily system.
Yes.
But when our immune system becomes very activated, such as in autoimmune condition and also in severe infections, such as in COVID-19, our immune system eventually becomes attacking our own body system.
Wow.
And making a lot of destruction, organ failure, and unfortunately some of the patients will die because of the cytokine storm.
This is so counterintuitive, because for me, when I hear that my immune system is being triggered more than normal, you would think that that would actually be more beneficial as opposed to being harmful, but apparently it's not. And what is triggering this in these patients that are suffering severe symptoms? Is it because of the severity of the symptoms that this is sometimes happening, or is it the other way around? How is this being triggered, Doc?
So when we are talking about the Delta variant, that is the predominant variant now, there is two key components that could cause the cytokine storm. First, we have a patients with chronic condition like hypertension, diabetes, old age, obesity, that already raise the cytokine level of the patients before they get the COVID infection. So we see that the level is already raised because of the chronic infection, and then they get hit by the Delta variant. We know that the Delta variant, it's 1,000 times more viruses in our respiratory system and in our bloods than the previous alpha, beta, and gamma variant. So we could see that with people already have chronic inflammation because of the chronic disease, multiplied the cytokine by 1,000 times.
Wow.
So when there is a threshold that already been surpassed, our immune system could not control the activation of itself. So that is the one that caused the cytokine storm and the subsequent hyperactivation of our immune system.
It's so,
and eventually, the
doctor.
activation will cause destruction in our bodily system, not protecting. At first, it is actually protecting. But at one time, when the virus is already clear, usually in a normally functional immune system, our activation of the immune system will be ceased. So it will stop activating. But in COVID-19 patient who had cytokine storm, the activation will go on and on and on. and it's like a cascade.
So could you say, Doc,
So
like because your immune system has nothing left to fight, it starts fighting ourselves instead? Something like that?
Yes, yes.
So you're saying that even when a COVID patient is already negative, they can still experience cytokine storm?
Yeah, actually, cytokine storm, it is unrelated with the status of the infectivity of the COVID-19 patients.
Right.
So, usually in cytokine storm patients, it is already past the infectivity period. Usually, the infectivity period is between day 5 to 10 when they are infected.
Yeah.
But as we know, cytokine storm usually happens after.
Wow.
So we see a lot of patients that first they could get better,
Yeah.
and then because the body could not stop the activation of the immune system, they are worsened after the 10th day.
10 days.
So can we prevent, like for example, is there a way to prevent COVID patients from experiencing cytokine storm?
Yes, that's a very good question. So actually, we already have the answer for many, many years. A healthy lifestyle,
Yes.
you get enough exercise, you get healthy and balanced diet, you get enough rest,
Yes.
and you are happy,
Oh.
and that will lower the level of our chronic inflammation. So if we already have low chronic inflammation, when COVID-19 hits,
Yes.
it is less risky for our immune system to be activated. And one thing that is more and more gaining traction in the scientific community, it is the benefit of intermittent fasting.
We do that. We do that,
Yeah.
doctor. Woohoo!
That's very good. As you know, actually, cytokine storm is already been trending at the first part of our pandemic, right?
Right.
But now, one of the proponents of the intermittent fasting, the previous weeks, he gets COVID-19 and cytokine storm.
Right. We were just
So
discussing
I
that.
think, I think that one of the protecting mechanism that the patient got is that because he enforced healthy lifestyle.
Right. We
By
didn't-
intermittent fasting, by exercising,
Well,
so that actually protect you.
That really makes sense because one of the reasons I started intermittent fasting years ago was because to reduce inflammation. I had no idea like cytokine
I had
storm
no
to
idea
do-
about that.
Yeah, and I had inflammation, physical inflammation in my joints, and it actually helped reduce that. So
Right.
that would make sense that it has a correlation. But again, this is something that affects people who aren't living a healthy lifestyle, Doc. And we do know those that aren't living
Yeah.
a healthy lifestyle are at risk for more severe COVID-19. So if it comes to identifying the symptoms, what are we looking for here? If, let's say, somebody is past the 10th day, are there new set of symptoms, or are they very similar to COVID-19, which I assume would make it harder to identify?
Okay, usually the symptoms of cytokine storm is the symptoms of organ failure.
Oh, wow.
So the first organ that will be affected is the respiratory organ. So if you are having COVID and then you are now doing isolasi mandiri, what you should do is to check your blood oximeter regularly.
Yes.
Because at the first, the signs of the cytokine storm is the lowering of the blood oxygen level. And as we know, in COVID-19, there is a term that is called happy hypoxia. So your blood oxygen level will lower, but you will not get shortness of breath.
Wow.
So that is very important to get a routine blood oxygen level measuring.
I have
usually
that at home,
every
Doc.
6 days.
You have it
Yeah.
too at
Yep, got
home.
it too.
Yeah, it's good.
Yeah.
And then what else, Doc?
Yeah. And then one of the symptoms that usually prevalent in patients with cytokine storm is the rising level of the D-dimer. Not because of the blood coagulation, but because cytokine storm cause massive damage in our tissue. So when the body system tries to correct the damage,
Yeah.
the waste is the D-dimer. I'm not recommending for the patient to routinely check your D-dimer when you got COVID. But usually, when the patients are hospitalized, D-dimer is one of the parameter that we see to check whether there is massive damage in the organ system of the patients or not.
Okay.
Okay, so if someone experiences cytokine storm already, what should they do to heal themselves, to cure themselves from the condition?
Okay, firstly, you could not cure yourself for a cytokine storm.
Oh no.
So when you got severe COVID symptoms with lowering of the blood gas, you should get hospitalized. Luckily now our hospital system is quite relaxed because of the lowering of the case.
Yes.
So when you got severe COVID symptoms, you should go to the hospital. Because there is some measures that we could do to help mitigate the cytokine storm, such as corticosteroids, tocilizumab, and then intravenous immunoglobulin, the same therapy that we gave to patients with autoimmune disease, but it is not a foolproof method. So we should still give the patients some supportive treatment, like oxygen therapy, fluid therapy, and sometimes when it is needed, we give mechanical ventilation or ECMO to help support the body system of the patient, so that eventually, hopefully, he or she could ride the storm after the storm subsides.
Well said.
Thank you so much, Dr. Stevens Sumantri. We have a lot of new insight about.
Thank you for making it so simple to understand too. By the way, 'cause
Exactly.
I had no idea. I couldn't get my grasp around this cytokine storm until now.
and you make it so easy for us to understand. And thankfully, man,
Yeah.
we've been
Trying to live healthy anyway.
trying to
right?
live healthily. So it's good to be vindicated by Dr. Stevens Sumantri. Thank you so much,
Thank
Doctor.
you, Doc. We really appreciate
Stay
your time.
healthy. Always.
You're welcome.
Have
Stay
a lovely
healthy.
day.
Good morning.
Morning.
Have a
Have a great day. What a great guy.